Hello everybody. My name is Francis Yang. I use he, him pronouns, and I am a third-year medical student at Michigan State University College of Human Medicine. And welcome to the program Overcoming Stigma, Incorporating Addiction Medicine into Undergraduate Medical Education. We have a wonderful set of panelists here that are going to kind of discuss what this program is, what this means to us. But overall, this program is meant to highlight the lack of dedicated addiction medicine training in undergraduate medical school curricula, how it was incorporated at our institution, how it was received to create lasting longitudinal change in medical schools, and really just share the overall importance of addiction medicine and its principles. So we're going to start with a short presentation on how this came to be, and then we have medical students at our institution from all different years, M1 through M3s, at which we'll introduce at that point. But without further ado, we have our wonderful addiction medicine physician, advocate, mentor, biggest supporter, Dr. Kara Poland.
Thank you, Francis. I'm Dr. Kara Poland. I use she, her pronouns, and I am excited to talk to you a little bit about what we've been able to accomplish. So we have a program called Michigan Cares, and as everything in Michigan starts with MI for our state, we call it the My Cares program. In January of 2018, the Michigan Department of Health and Human Services convened a meeting of all MD and DO colleges in the state of Michigan, which is number 7. And a representative from each university. We went around the room and talked about what we were doing around opioid education. Specifically, MSU, just by virtue of geographic distribution, was the second to last school to present. And by the time it came to me, it was pretty clear that we were teaching our students how to take off the airplane, meaning start opioids, and how to land the airplane, meaning taper opioids or discontinue opioids after acute surgery or other acute events. But we weren't talking about what happens in the case of a mid-flight emergency. I don't know about you all, but as we start opening up after COVID, I really want my pilots trained in emergency landings. And unfortunately, we weren't teaching our students the equivalent in terms of what happens if somebody's having problems with these medications, what happens if they develop an opioid use disorder, what happens if they start developing any sort of unexpected or aberrant behaviors, overtaking their medication, how to identify addiction versus inadequately controlled pain. We weren't talking about these sort of nuances of addiction treatment. So when it came around to me, I asked the group if everyone would raise their hand if they had on their core faculty either an addiction medicine or an addiction psychiatrist, and no other school had one. And so that was what My Cares began with. We started by training through something called the Practice Pathway, addiction medicine board certified specialists to be on core faculty for the universities, because you can't train medical students if you don't have the expertise in your institution to train them. So let's talk a little bit about the background of where is addiction medicine in both undergraduate medical education and then in graduate medical education. So what we like to talk about at Michigan State University is creating a great first day resident. That's our goal. So we want people to enter their GME experience feeling well prepared and ready to hit the floor running. Yet, in general, in undergraduate medical education, courses dedicated to addiction medicine are rarely, if ever, taught in medical schools. Often they're kind of embedded within maybe a psychiatry clerkship, often taught by a general psychiatrist. Maybe there's bits and pieces depending on where a student does their primary care rotation. They might see some prescribing for addiction treatment, but there are very minimal expected competencies in the NBME blueprints, meaning that most schools aren't able to prioritize this as a topic. There's no national data on the proportion of medical school curricula hours dedicated to addiction medicine, but best guesses range between 2 and 10 hours on average for most medical schools. Yet addiction affects all organ systems and all physicians should have a baseline competency in treating persons with a substance use disorder. Given the fact that over 100,000 people died of an unintentional overdose in the 12 months preceding November of 2021. Another nearly 100,000 died of alcohol-related causes, and 480,000 people died of tobacco-related causes. And that doesn't even include some of the addictions that maybe have less death corollaries readily available for us for research purposes. That means 700,000 people in 1 year alone in the United States died of an addiction-related illness. I don't think we're paying enough attention to it in medical schools. And what I found was that when I talked to faculty about this, when I talked to administration about this, I didn't get the buy-in that I needed. And so what happened was some students reached out to me that were undergraduate medical education students and asked if we could start talking about learning more about addiction. And so it started with a petition brought forth by some of our now graduates, but brought forth a few years ago, asking for more addiction education. So we started what we call an intersession in year one, which is essentially an elective. So we started with an elective, and then we have during our year two, we have about a half a week of addiction dedicated time in our curriculum for all medical students. And then we offer a 2-week elective in year three and an advanced elective in year four is under development. And we hope that by making these offerings and seeing students elect them, that we will have kind of that day one ready resident. So here's what MSU's curriculum looks like in the 4 years at a glance. So the intersessions are electives that come at the end of the first year and again at the end of the second year. Our offering is only available to first year students, so kind of in that May, June timeframe. And then in December is when they will get their dedicated curriculum that all medical students receive. And then again, sometime in year three and again in year four, they'll have 2 more opportunities to take additional more advanced electives that are offered through the MyCares program. They also have some electives in years 3 and 4 that are clinically based electives as well. So what we first did was we took a deep dive into the USMLE steps, as well as the COMLEX steps for those DO students. We found that steps 1 and 3 focus heavily on the intoxication and withdrawal symptoms, and step 2 focuses on the epidemiology, biostatistics, and ethics. So MyCares covers 100% of the topics areas that for all USMLE steps in our online asynchronous platform that is available for free to any medical school that chooses to assign it. During our initial intersession, again, that's our 4-week elective. Last year, we offered it to 32 students and ended up increasing our cap to 36. And this year, we opened to 48 students. And again, we're asked to increase our cap to 52 students, and we still have a wait list for this elective of 200 students. So that means over 1/4 of the students are saying, we want this education. We want to learn about addiction during medical school. Our elective utilizes the MyCares modules, the ones that my team created, as well as some national resources from PCSS or Provider Clinical Support Services. We have large group interactive lectures. I don't like to use the term lecture. I like to call them like the fun topics. So I have national speakers that come and talk about things like harm reduction, upcoming therapeutics, on the rise topics, including things like immunizations against substance use. We have the guy who runs the NBA program for like the Basketball Association prevention and treatment program. He comes and speaks. So we try to keep it upbeat, a lot of fun, and kind of highlight all the varied careers that somebody can have as an addiction medicine or addiction psychiatrist. We dovetail that with our Friday casual coffee with the experts. So addiction is a multi-specialty subspecialty, which means that you can become board certified in addiction medicine from any primary specialty through either a pathway through the AOA or through the ABMS. So both MD and DO certified physicians are eligible to become addiction medicine specialists. And so we have an ER doctor, we have a primary care doctor, we have an infectious disease doctor, we have a hospitalist, we have people who do all different types of addiction treatment come in and sort of talk about their career plan and the exciting things that they get to do as a physician treating persons with substance use disorder. We do a Kahoot, so we kind of do a contest every week. We utilize board style questions in our context and in our contest, and the student that wins each week wins an Amazon gift card. So we kind of keep it fun and hopefully increase engagement by doing kind of those fast-paced Kahoot questions and having prizes available at the end. In addition to that, we also do small groups with clinical cases to kind of work through those details that students have reviewed in their independent study, which is all those guided modules. Here's kind of what a week in the life looks like in terms of the time dedicated to this. It is the elective is 4 weeks long, so the students get just about 80 hours. It's technically, I think 75 and a half when we pull it all together. This is looking at our 2-week introductory elective. Again, we pull on those PCSS as well as the MyCares modules and another nationally recognized resource called Scope of Pain to make up those clinical hours. This has been mirrored for MSU students both at the College of Human Medicine as well as at the College of Osteopathic Medicine, which is great because it is all asynchronous. We're able to offer it to a volume of students without it requiring a lot of faculty time. But yet we make ourselves available for our students for questions and we'll schedule time to meet with them if they want. When we looked at our global curriculum, so the curriculum across the 4 years of medical school, we pointed out stigmatizing language such as abuse, addict, track marks, sobriety, relapse, and replaced those with evidence-based, person-centered, person-first language that we've tried to remove as much of the judgment and stigma kind of inherent to those words. So when we think about somebody who abuses something, it's usually in a negative connotation. So it's child abuse, it's elder abuse, it's things where those are bad people doing bad things to other people. And people with a substance use disorder aren't bad people. So removing some of those stigmatizing pieces of language hopefully helps bring our curriculum to the next level. We updated the management plans to be more evidence-based and added, and added coexisting conditions rather than individually calling out, co-occurring depression, co-occurring anxiety, because we know that people can have all sorts of coexisting conditions and not only mental health coexisting conditions as well. We utilize the American Society of Addiction Medicine national guidelines as our steering guide, as well as a resource for these curricular updates. In addition, we implemented a free buprenorphine mini course for medical students, also provided by the American Society of Addiction Medicine. This buprenorphine mini course is a 1 hour long course. So for people looking for ways to integrate it that don't take a lot of time and that students can do as independent learning, I often will recommend the ASAM course for that. In addition, our shorter MyCares modules that are very board specific. So they were written to reflect step 1, step 2, and step 3. Each substance, there's 8 substances, is about 20 minutes. Opioids is a little longer because there's a little more to cover in terms of medications. But we tried to make those very board relevant so that they would also act as a board study tool for our students. Here are just some future directions that we're hoping to do. As I mentioned previously, if you or your college is interested in implementing some of our modules, we do offer them free to schools and to students. So you can let our team know, and we'd be happy to share that as well. And we'd like to see an expansion of addiction medicine in our undergraduate medical education beyond sort of those minimum required hours that we have in their second year of medical school. We are going to move on to talking to the medical students from Michigan State University, and I'm going to turn things back over to Frances. Thank you so much.
Perfect. And thank you so much, Dr. Poland, for that presentation. And as she said, we're going to turn it over to some of the medical students at Michigan State to share their perspectives. We are thankful enough to get 3 years of perspectives from M1, M2, and M3 students. And so their names are Brian McAllister, Emily Beardsley, and Krista Schaefer. And we probably will go in that order from M1 to M3. So without further ado, Brian, if you'd like to introduce yourself and share a little bit.
Great. Thank you, Francis. Once again, my name is Brian McAllister, use the pronouns he, him, and I'm a first-year medical student. And I am thoroughly excited to take the elective, the addiction medicine elective course just starting next week for this year's curriculum. And I was asked to kind of share where my interest came from. It doesn't surprise me that there is so much interest amongst my classmates as well too, having those discussions with my peers, that this is a topic a lot of us are very well familiar with before coming to medical school. And I think it really kind of speaks to that, we talk about and Dr. Poland mentions, the interest in this and the desire from students and the drive for students to get this. To me, it really kind of is an expectation of medical schools at this point that we get proper training in addiction medicine based on the severity and the impact in the community. Because that's another thing at MSU, which speaks to, really driving a lot of these curriculum innovations in addiction medicine moving forward, is, MSU is focused on community-based medicine as well and being active in the communities. I know for me, before coming to medical school, was very active in the community, and you can't be active in the community without seeing these impacts of substance use disorder, addiction, and overdose. So for me, it was really an expectation that I would get that training to be able to effectively manage substance use disorders with medication-assisted treatments, knowing that that is also too really difficult to have access to in the community. And I want to be able to help provide more access to that at the bare minimum once I'm done with my training. So I'll just leave it at that for now and pass it on to fellow classmates.
Thank you, Brian. My name's Emily Beardsley. As Francis said, my pronouns are she, her. I am a second-year medical student at Michigan State. So last year, I was lucky enough to take the addiction medicine intersession or elective during its first year. So I found out I was interested in addiction medicine actually last year, just prior to the beginning of the intersession. Dr. Poland spoke to a group of people about substance use disorders and the importance of treating addiction. And through that, I became more and more interested and met with Dr. Poland and then decided to take the intersession. So the intersession was an amazing opportunity. It offered us such a variety of learning opportunities between the cases that Dr. Poland had created, as well as the different speakers that came in every Friday. We had such a great variety of learning opportunities to really dive deeper into the field of addiction medicine and substance use disorder. Now going through my second year of medical school, I've experienced the second half week that we have dedicated in our curriculum to kind of go over more on addiction medicine, which kind of highlights the importance that everybody in my school needs to experience. So for me, I think addiction medicine should be incorporated in everything, just as Brian said. Addiction is everywhere. No matter what field of medicine you go into, we're going to experience it. Substance use disorders are everywhere. So the more we are able to experience this from an earlier point in our education, I think the better we will be able to handle those situations when we come across them in our career. And then I'll leave it for Krista.
Thanks, Emily. My name is Christine Schaefer. I use she, her pronouns, and I am a third-year medical student in the College of Human Medicine at Michigan State. I am pursuing a residency in pediatrics, so not addiction medicine. And I took the MI Cares elective.
You can still do addiction medicine. It's a fellowship. So don't worry. You can become a pediatrician as your primary residency and then still do addiction. There's hope yet for me.
There is. She's been trying to convert me. But I took the MI Cares as my third year student elective. And addiction was a topic that held extreme personal importance for me. So when I picked out a medical school, I specifically sought out a program that was going to emphasize addiction medicine in its curriculum. And like Brian said, it was something that at this time in history and in our state especially, it was something that I expected from my school. I think our school's curriculum does have substantially more addiction medicine content than some of my colleagues at other schools, but it's still probably totaling around 6 hours in the first year, we calculated. And even with that emphasis that our school provided, I had already seen what in like my limited clinical experience as an M1 as an M2, that my knowledge of substance use disorders was not going to be sufficient for my clinical clerkship rotations. So by the end of my second year on paper, we were all prepared to take our step 1 examinations, and we had the skills to be able to identify what substance a patient had taken from a multiple choice list, but that was about it. I couldn't really have a comfortable conversation with someone about substance use or know what questions to ask to take a complete history. And in working with some of my classmates, I saw that I wasn't really alone in this, and that collectively we were so unpracticed in discussing substance use that our nervousness and really lack of confidence sometimes bled through to our patients, and it really made our patients feel more stigmatized than they already were. So after step 1, I took the MI Cares addiction elective as my first elective before all of my clerkship rotations. And I really don't think it was an understatement to say that it completely changed my learning experience for my clerkships. It became a pertinent topic in every single one of my rotations, and it was relevant to at least half of the patients that we interacted with. From like addiction medicine, from my internal medicine rotation, where we would come across withdrawal from alcohol use or substance use at least once a day. In my psychiatry rotation, where in that rotation alone, substance use disorder is relevant to about 5% of what we learn and 95% of the patients that we interact with. I even used it in my pediatrics rotation, where we often saw neonatal abstinence syndrome. Not only did this elective really prepare me to have the clinical knowledge to succeed in a clinical rotation, but it gave me the confidence to really have these conversations that I needed to, and to be able to adequately screen and manage and treat patients with substance use disorder. And I think that one, hopefully it not only makes me a better day 1 resident, but it also will make me a better future provider.
And now everyone knows why I am the luckiest physician to get to work with the students at Michigan State University. But I'll turn it back over to Francis.
I'm pretty sure, Dr. Plum, we're the lucky ones to have such a great mentor and advocate as you. So thank you so much for all of your guidance and for all that you've done for our institution and will continue to do really for everybody. So thank you. And thank you again to all the speakers so much for your perspectives from someone who's about to take it and why they're going to take it, someone who just took it, and someone who took this elective with the 3rd and 4th year kind of clerkship perspective. I think that's hopefully gives a breadth of perspectives that folks can take from. So thank you all for speaking. And I feel like there's an obligatory, like, any last words of wisdom, comments, anything else that folks would like to share before we give some closing remarks? Going once, going twice.
I always have something to share. I'm terrible at this. No, you gave me the opportunity. The other thing that I just really, another big teaching point, right, is we learn so much from our patients. And I think also too, from my experience, I've learned the most from folks in recovery. That speaks so much to, for me, my personal interest in addiction and medicine too, not just in regards around, healthcare and whatnot, but just life in general, is something it's been really rewarding working with folks in different stages of recovery.
I did fail to mention that as part of our elective, we do have on our Friday, on our kind of fun Fridays, we have folks in active treatment who come in and talk about their treatment, their successes with treatment, their challenges with treatment, and also specifically the challenges with the healthcare system and what they would like to see future physicians do in terms of treating patients and persons with a substance use disorder.
Thank you for those last comments. I agree. Having those perspectives really, I think, not only challenges a lot of what we learn about medicine as well, but really gives us that full holistic picture of what an individual has to go through. So yeah, if anyone else has nothing like to say, I'd just like to thank everyone who's watching out there. I hope everybody was able to take some actionable items from the session, some specifics, anything you may need in order to be able to advocate for sustainable curricular change, and hopefully to incorporate addiction medicine to a greater degree in your curriculums, and to ultimately address this worsening substance use and addiction medicine crisis that our country is facing. I think we all agree that principles of addiction medicine, as everyone has spoken about here to some degree, it just really permeates throughout all of medicine, and at its core, we really believe can help train more compassionate, competent, and affirming providers who always consider the whole individual. So as folks have also said here, anyone can have a substance use disorder or suffer from addiction. Often those most vulnerable in our society, but also even our peers and our colleagues, individuals that may present really in any specialty and setting. So again, want to thank all the speakers for sharing their perspectives and for educating all of us. And thank you for watching.